All right.
All right. Welcome back, everybody. I am Dr. Greg Eckel.
Dr. Jonathan Nadal.
And we are talking how to stay healthy in any season, and in particular, utilizing our immune resiliency programs. And this is, it's that time of year, back to school. Fall is upon us. We're getting into cold and flu season. And we have been putting some deep thinking and thought into how to best support people in light of all of the misinformation that has been happening out there around your innate immune system, around your resiliency, and around your terrain. So I want to say, this is we're going to have some fun today, right? This is classic What the Health, the Doctor's Chat material. And why? Because we're bringing information to you that you are not going to get from the top down. This is not getting broadcast on mainstream media. In fact, this is information that really can change your life because it has been implemented for 22 years in clinical practice and help you, your family, and your community's health, right? And I mean, that's a big claim. That's a big claim, doctor.
Well, it's true though. So that's not.
Yeah, it is true. So, this component of, let's just start out with a discussion of germ theory versus terrain, because, some folks that have been long-term listeners, they've heard us talk about this before, but it came down to a debate between Louis Pasteur and Marcel Beauchamp. And Pasteur won the debate, right? Well, I don't know if he won the debate, but he had the propaganda on his side, let's say. And that was about the bug. He discovered antibiotics and penicillin. So penicillin, the wonder drug of the 1930s. And that was basically the change of medicine, where the advent of antibiotics really put the kibosh on all natural medicine in North America. And so what was the debate? The debate was around, is it the germ or is it the terrain? Pasteur's contemporary was Marcel Beauchamp. And he, I would like to say, was a naturopath at heart, because his whole point was, wait a minute, Louis, if it was the bug, why doesn't everybody that gets exposed to it get sick? Right. So it clearly, and that's germ theory of like the germs and like wear the mask and wash your hands. I'm all for proper hygiene in a public health setting. Like hand washing has been shown to be awesome. Really top-notch things to stop spreading germs in the ER and surgical centers. Once they put in hand washing, the rate of death in surgical centers went way down. So, of course, stop picking your nose. Don't put your fingers in your nose, people, because that's how you get germs up in there. But it isn't just about the germ, right? Because everybody gets exposed to it, but not everybody gets sick. So Beauchamp's whole take on it was, well, maybe it's the terrain. Maybe it's the strength of the individual that really matters here. Because if everybody's exposed to the bug, why doesn't everybody get sick? And why doesn't everybody get sick in equal amounts or severity?
Yeah, and it begs to question, so fine, let's blast the bugs away, kind of gets, if we picture the enemy and can deal with them, that's it, right? And you could look at it from kind of an abstract level, like macro to micro, but come on, like the underlying terrain and the human body, if you build that up enough, then you probably don't have to deal with the superbugs as much, and you can still deal with them, but it doesn't mean you need to ignore the terrain.
Right. And I don't want to come across as it's an all or nothing component, right? We have a moniker where East meets West naturally. We want to do what's most appropriate for the individual in front of us. So we're into choice, and it's not the same approach for everybody, because everybody comes to the table in different levels of resiliency, right? So we're talking about immune resiliency of like how adept, how robust, how responsive, how flexible is your immune system response. So just to wrap up the Beauchamp pasture component, it's the terrain versus the germ. We know that germ theory is incomplete because it's not just about the bug. It's about how healthy is the individual, or how resilient is your terrain. If your terrain is hospitable, the viruses or bacterias or infections will ravish. If your terrain is not hospitable, they're not gonna set up shop. And we see this time and time again. We see it, as we age, our immune systems tend to become less resilient. Now, they notice the languaging that I'm using there, because it's tend to become. It doesn't mean that they have to. It's a very common phenomenon, but it is not. It is not normal. It's common. So that's why we saw, predominant age of death with COVID was over 75 years old. And that, I think, speaks to the vitality of our population. How healthy are they? What is the terrain? I think the state of health in North America is dismal at best. People don't understand how their immune systems work. They're not educated. In fact, there are laws been passed that we're not able to actually educate you about that. We're going out on a limb on this podcast by talking about it, because I feel like you should know what your physiology is. You should know what the biochemistry is. You should know how your body works, for crying out loud, right? So I'm not making any claims. I'm going to talk about your terrain. How do we make your terrain more resilient, right?
Right.
And this was the brain child of Dr. Nadal and myself in creating, how do we meet people where they're at? And we're just going to walk through just how we think of putting together a superhuman program for people on immune resiliency. And, it starts with assessment. So I want to start there. Let's start at the very beginning.
Yeah, as it should. Definitely. And so, being, like you said, we're East meets West. Of course, we were the lens of being integrative physicians and testing, from levels of functional medicine, but still doing blood work where we can find a wealth of information on the immune system. We started realizing year to year when patients come to us and they share with us, like, oh yeah, I had this blood work done last year, the year before, this is what it showed. A bunch of things just not there, from different inflammatory markers, and even someone presenting with chronic fatigue and always being prone to infections is like, wait, they're not checking for mold or for things like, dormant EBV or CMV. It's like, wait, these aren't even hard to do. And it just literally is just checking a couple of extra boxes off and seeing what's going on. So we decided to start there, like, all right, even this basic blood work that is everyone's supposedly getting with their main doctors, all right, let's take that up a significant notch and actually do a deeper dive into inflammatory markers like IL-6, some of the viral markers that I mentioned, because we know, especially with some of the conditions that you had mentioned, if you have kind of a behind the scenes load or burden with some other viral markers that maybe aren't showing any symptoms overtly, that's going to make any other viruses or illnesses much more potent and difficult to deal with, because the bucket, or how filled your immune system is and what it's dealing with, is already at the top. It's already overflowing, right?
Yeah, so I want to talk about just even the reference ranges. So on just an annual blood panel, we see so many people that say, "Oh, I had my annual physical. I had blood work. They said it all looked good."
Mm-hmm.
And you ask, did they actually go over that? Do you know what you had tested? And we get the records. We request the records because we don't want to recreate the wheel for people.
Mm-hmm.
It's not complete. It's not even close to complete. Their basic panels for us we're talking about a lipo profile, a lipid profile. We want to look at particle size of cholesterol, just starting there. Cholesterol panels came into practice 1954. I don't want to use that antiquated test. Cardiovascular disease, #1 killer. We're talking about the terrain. How vital, how viral are you? we want to look at that. We look at the CBC, complete blood count, with a differential. What's the differential? That is your white blood cell count, what the symphony of your immune system is playing. What are your white blood cells doing? There's neutrophils that fight bacteria, lymphocytes that fight viruses, monocytes are early inflammatory marker, eosinophils are for parasites or allergic responses. So we want to look at the percentages, the interplay. Are the lymphocytes elevated? That means you have a viral load that you didn't know, even if your white blood cell count isn't raised. And this isn't even getting into the nuance of what an optimal level is. So many providers, and definitely the lay public patients, don't understand there is no normal blood work, right? It's 2 standard deviations around an average. And I do not want to compare you to the general population out there, because I don't know if you've been paying attention, but there are a lot of diseased, sick people walking around. You know, the average medication load for a 55-year-old in North America is 5 prescriptions. That's the average. 5 prescriptions. That's not health. That is not even better living through chemistry, as we see our age, you know, our life expectancy reversing, getting shorter for the first time in history. And it's not just from COVID, right? It is our whole, we're dying at younger and younger ages now. So it does talk about the vitality of the population. So we don't want to compare you on a reference range. We have ideal numbers that we're looking at, and we have specifics like Dr. Nadal mentioned, the interleukin-6. It's an inflammatory marker. It makes very good sense to look at that, especially with immune system response. We have that chronic viral panel, and you said CMV and EBV, and even we have COVID on that panel. Well, what is that? Cytomegalovirus, Epstein-Barr virus. We're seeing people with post-COVID infections where they're Epstein-Barr virus from when they were a high schooler, which was mono, the kissing disease. That's where EBV comes from, gets reactivated. That part of the long haulers component. This is a big aspect of getting these numbers dialed in and taking a look at that. So, you know, that's just a general panel. So when you say, I got my general panel done with my primary care doctor, guaranteed it is not anywhere near our basic panel. And that's the basic panel. So then on top of that, we're adding anything else on the lab work that you want to say on just like a general Western panel.
Yeah, no, I think you hit the nail right on the head. Just keeping in mind that those ranges is more of the average of the average sick American next to you. Like, and that is not the average that we want to pin you down through. Like, there's so much healthier functional levels that we want you to reach for. Yeah, it's a matter of perspective and the lens. So yeah, it's good.
Yeah, perfect. And so looking at terrain, it's not just blood work. So we also want to look functionally, like what is going on with your hormones. That's a very low hanging fruit, meaning if you're having any sleep difficulty, if you have any anxiety, if you have any repetitive thoughts, if you have digestive issues, gas or bloating or heartburn, all of those, or fatigue for crying out loud, all of those things could be a result of your hormones being out of balance. So we look at your cortisol, diurnal variation. We look at your testosterone level, your progesterone, estrogen. We look at the breakdown products of that. We look at the methylation pathway of how your liver is detoxifying and your phase 1 route of elimination, cytochrome P450 cycle there. For those that are wanting the technical aspects there, I know you're out there. So that we want to look at a hormone panel, and that actually comes in our blood work. We're looking at thyroid up there, testosterone, estrogen, progesterone, sex hormone binding globulin. That's part of our annual free and total testosterone, total estrogens, progesterone. So we look at it in the blood. We also look at it in a functional analysis. Again, diurnal variation, cortisol is changing throughout the day. So it makes sense to us to know what level of stress are you on or under. Stress lowers our immune system function. So when you are stressed, your immune system's not functioning well. What other signs around that test are we considering there?
I mean, even a big one, even pain. So we know that the variations in cortisol, especially if it's dysregulated, is going to limit how well cortisol can function as an anti-inflammatory hormone, because that's a huge
Mhm.
piece that a lot of people don't know. I mean, it's very similar to like if someone's getting a cortisone injection. What do you think that's doing? It's very much mimicking some of the anti-inflammatory effects that our adrenals are going to be promoting through releasing cortisol at strategic times throughout the day. So, and who isn't in some type of chronic pain? I mean, thankfully, not you and I right now, but still, like,
No.
yeah, me neither. But it's having these levels in check and addressing them and digging further. You know, when we see cortisol levels dysregulated, that what does that mean too? That means that there's a pretty direct relationship with blood glucose and how fast it's essentially getting the liver to dump glucose in the bloodstream for that energy. And if there's an imbalance in blood sugar metabolism, guess what? That can kind of give us a sneak peek into potential pre-diabetic situations. We know that if cortisol is dysregulated and blood sugar is off, that's going to have direct inhibiting effects on the immune system. So it's really by knocking on the door of cortisol, the adrenals, and the endocrine system, we're getting a much deeper picture on how the immune system is actually working. And another neat thing with the Dutch test is that some of the organic acids and the neural related markers, we're getting a pretty clear picture on how the endocrine system is interfacing with the nervous system. And that's not something people talk about enough because they're really two giant systems working on either side, you know? So there's a lot to that test that is important to go through.
That's great. Yeah, thanks for bringing up those organic acids and the other markers. The other big one on that one is that there's an 8OH marker, which is specific for environmental toxicity. And I've got Dr. Joe Perzorno to thank for really educating me about that marker, but also the whole community, so much so that it made it onto a functional lab test. So 8OH is a marker for any environmental toxins that could be damaging DNA or free radical level in your environment. So it could alert you for acute toxicity in your environment. And again, really couching this in understanding and the discussion around the terrain, like how fit, how resilient is your terrain. So we want to look at that. You've heard us talk time and time again about the microbiome being the second brain, but it's also 86% of our immune system surrounds the gut in the gut associated lymphoid tissue, the GALT. And, you could eat something here and it could just pass through your tube out your anus and it literally was never actually inside your body. I put air quotations for people listening there and not viewing. And so what do I mean by that? If it hasn't been absorbed through the mucosal lining of your body, so through the mouth, through the esophagus, down to the stomach, into the small intestine, then into the large intestine, then out of your body. If it doesn't go through, so that's through the lumen, through the hole that goes through the middle of your body. But if it doesn't get absorbed into your bloodstream, it's not actually in your system. I would say. Now, you might argue with me, Dr. Nadal, because you get like that sometimes. But
I don't know what you're talking about.
I know you don't actually get like that, but I just wanted to make it compelling.
Oh yeah. Well, the fun part is that by bringing up how if it's not absorbed, we're directly speaking to the opposite problem, right? Because sometimes with things like leaky gut, too much is getting absorbed, even the things that we got to get rid of, right? So on one side, we have absorption and assimilation issues where people are not absorbing the right nutrients, and which could be due to a number of things like pharmaceuticals and whatnot. But then on the other end, we have leaky gut where people aren't absorbing their nutrients well. And if anything, a lot of the toxins and buildup that should be cleared through their waste is actually going into their system and causing a whole litany of symptoms that otherwise wouldn't have happened.
Yeah. And yeah, great point. And but again, it's a test, don't guess when we're talking about resiliency and what does your terrain look like? Now, people can get carried away here and do thousands upon thousands of dollars of testing, and then they start treating tests. and I see this a lot in functional medicine, more is not necessarily better here. In fact, I've seen some folks, they get a $25,000 workup on every test that you can think of. And I've seen these reports and they contradict each other. And it's like, oh my gosh,
It's like
which one?
Yeah.
Yeah, it's a tome that comes in. It's like, one, who went over that? How did you as the consumer individual digest it? How did you understand it? How was it presented? Like, it's a tome. And honestly, I'm going to make the claim is it's not good medicine, in that if you take a good case and you understand the person in front of you, you know exactly what tests to run. And that's why I'm saying, we're telling you a couple of the biggies on our superhuman resilient test, because these are the levers that through time have made the biggest difference for our patients.
Yeah, there's got to be like a intention, like a zhong of the formula that we always talk about,
Yes,
right?
I love that. Yeah. What are the last two that we really think about on a broad spectrum view?
Yeah, well, some of the popular ones too. If we see the gut and its direct impact on the immune system and hormones, like we talked about, it's a couple of things. Like, let's say we run a GI panel and we find that maybe there is some elevated fungi or yeast. Then, and depending on symptoms, we may be prompted to do a full mycotoxin panel, mold, right? Especially living in the Pacific Northwest, like, what's the statistic that's pretty staggering? Like, how many households, like, you know that?
It's actually in North America, greater than 50% of buildings have some water damage to them in their lifetime. So of public spaces and homes, 50% plus have some mold component. Now, I grew up in Western Pennsylvania, which is, our claim to fame is the third largest cemetery in the United States. And why is that? I don't think I've ever shared that with you, but it is because we've had 3 massive floods through 3 different decades of life. And thankfully, they capped the dams, they put them in a container. That's not happening anymore. But that caused a lot. The flooding in Johnstown, Pennsylvania is, it's world renowned, maybe not world renowned, but it made it into a Springsteen song. How about that? So it is. So I grew up in very moldy environment. So thankfully, I don't have the genetics that predispose me to mold issues. I can definitely smell mold. I'm mold sensitive because I know what it smells like. But we see folks, when you get mold sensitivity, toxicity, or illness, it has profound effects with your immune system. It leads into MCAS, that's mast cell activation syndrome. It leads into food sensitivities, environmental sensitivities. You're like the canary in the coal mine. Like, you can't walk down the perfumed aisle in, Fred Meyer or Nordstrom's. You can't go near, where they have the perfumes, or you can't go down, I call it the toxic aisle, the one that has all the cleaning products that just reeks like all bejesus. That stuff needs to, that's a telltale sign you're not detoxifying well. Perhaps your immune system is way overregulated. Also, we know that stuff is not good for you. Like, if I get into another Uber car and they have an air freshener in there, and then I have to educate them that they're creating cancer for themselves and their riders.
Just yank it down. Yeah, just yank it down.
I don't touch anything up there. However, I do educate them. And I would say straw poll, 9 out of 10 guys are like, thank you so much. I had no idea. And they get rid of it. But it just is, I'm intolerant of that now. And I can't believe that people don't understand, like, those air fresheners are toxic to our health. So this component of the mycotoxin testing, we do put that in where appropriate. And it's a massive hidden smoking gun for so many people with immunocompromised, chronic fatigue, long hauler symptoms. Why did your buddy or your lady friend get long haulers where you both had, COVID at the same time, and one person gets it, the other person doesn't? there's a variety of reasons. Mold may be underlying that, genetic platform. Your level of vitamin D going into the illness also could have an impact.
Yeah.
There's a big one that I think a lot of functional integrative medicine folks have tuned into. One of my mentors, Dr. Dick Tom, actually wrote a book in the 90s saying, "Are food sensitivities causing you your illness?" And we kept this one last here because, while food is your best medicine, it may or may not be causing you illness, right? How many times do you see patients, they say, "I eat a pristine diet. It's so healthy." And they may be eating superfood after superfood. And then we run something like this and it's like, "Oh, look at that. We found your immune system is reacting to your superfood," right?
Yeah. It could be healthy in many ways and even culturally like a staple, but guess what? Your blood's not gonna lie. And if your body doesn't like it, it's just.
So one component of this, so the way our bodies react to food, there's 7 different pathways that can happen. Traditional allergists do a skin scratch test, right? They put the panel on you and see, okay, do you get a reaction in your skin? That's IgM. I don't know anybody that's reacting to food in their skin. Do you? I don't like the test. I find it not to be applicable or really useful for folks. Then there's blood tests. So the standard of care in Western medicine is IgE. That's the, folks developing shellfish allergy, peanut allergy, which actually those types of allergies have increased quite a bit in the last couple decades with peanut allergies, et cetera. Well, I have some hypotheses as to why that is, but where I'm going with this, that's IgE. IgM was the skin scratch test. There's IgG, hypersensitivity delayed reaction. That's the one that we test for. There's also
I think you're breaking up there a little bit. Yeah, I don't know if it's me or you, but we're gonna keep going, unless you're talking at the same time. But yeah, just going through the different immune globulins, the different kind of stages of our immune response, and the different cell lines that come through it, and arriving at IgG eventually, which is a huge part of some of the tests that we run. And okay, here we go. All right. So, yeah, some technical difficulties here. I will see what's going on and we will come back. Okay, so stay tuned and don't go anywhere. Hi.
Hi. Hopefully, have you been going? Have you been on the whole time?
I didn't know if you were still talking simultaneously. So I just gave like, okay, we're talking about IG, the different ones, and then I kind of paused and just stopped the recording.
Okay, perfect. So we're back on Facebook Live, and we can I think we're recording again. Yeah, here we go. All right, we're recording again. So where I got bumped off in cyberspace there. So did you cover any ground there? No. I was kind of mid-sentence. Okay, no problem. So so basically I'm going to put my arms up here. Hopefully we can get that edited. Otherwise we are live. So here we go, folks. Welcome to modern technology at its best. I was kind of winding up on the immunoglobulin testing, right? And we have 5 ways that our immune system, immunoglobulin G, A, M, E, and D, those 5 ways, and then 2 complement ways. Now, the gold standard, if you want to get them all, is an elimination diet. And I actually do have an food elimination diet booklet made. it's the gold standard. It's very hard to implement, especially this day and age with our go, go, go here, with everybody going which way, if you've got kids or family or even in community, it's very difficult. Occasionally we'll pull that one out, but we do a IgG test. It kind of cuts to the chase. You eliminate foods for 6 weeks to 3 months, and then you reintroduce them to really get at root causes for your illness or, again, optimizing your terrain. So we're going to really focus going forward, because we can talk about optimizing your terrain. And we don't really treat bugs. We don't treat dis-ease. We don't treat illness. We treat heart-centered beings moving through time and space. Now, all right, so that was a big, big wind up there to on the assessment front, which quite honestly, everybody wants to jump to what can I do? What can I take? But that assessment is crucial because it sets the stage as to what's the best, most appropriate next step for you. So if you're interested in that, please reach out to us. We do these priceless complimentary consults. You get our undivided attention, 45 minutes, and we're really uncovering some root imbalances and discussing whether we are a good fit, if you qualify for care, and if there's anything that we think we could do, we'll offer that to you. So I'm just going to put that out there right now, mid-show.
Okay.
What else can we do? Let's give a tip and a trick for optimizing immune system. What's a tried and true naturopathic technique that you can do at first signs of illness, Dr. Nadal?
Oof. Besides some of the pillars, like making sure that you're getting good rest and a lot more hydration and water, like doubling down on it. Just anything from what your grandmother may have told you, like gargling with salt water, right?
Mm-hmm.
And you didn't lose me. You're still seeing me, yeah?
I'm still seeing you.
Okay, great, cool. Now I'm seeing me too. Yeah, gargling with warm salt water in the morning and night. I mean, neti pots and some of those other kind of nasal lavages, it's its own thing, and all those are great. We can't forget that we are mechanically irrigating the system, right?
Yeah.
So everything that our biology is trying to do at a snail's pace, it's okay to amp it up and take it further with some physical measures, which leads me to open the door to more hydrotherapy. And yes, yeah.
Hydrotherapy. I love it. And those foundations, while, they're not so sexy, right? So people aren't really promoting those things, but those basics really do matter. When we're talking about terrain, optimizing your system in these miraculous vessels that we take for granted on a day-to-day basis, these simple things go so far. Like we literally are light beings. So like getting out into nature, right? I've got a friend who studies cortisol response, like go figure, going for a walk in the forest or even the park reduces cortisol levels by 25%. I looked at him, I said, wait a minute, we need research to tell us that that's good for us. But, okay, sure. The data, we love data, love researchers. We love good p-values, right? So that's on, is it a good study or not? Those are amazing things. Now, there are also supplements. Now, we're not going to give you the laundry list, right? Everybody wants the laundry list of what can I do? Our mushroom complex is good. How about vitamin C? EHB is one of my favorites for cold and flu season, first signs of sniffles. But this is not medical advice. It's just here to say there are a lot of options. The testing and the assessment really sets you up for your best program, right? So what Sally and Joe are doing isn't necessarily the best thing for you because they have a different genetic framework. They have different stressors. They have different issues that are pulling their vitality and their terrain out of balance. So it doesn't make any sense to compare yourself to anybody else. Yes, there are some tried and true things, like we grew up in the home of Linus Pauling of vitamin C fame, right? Oregon State University has the Linus Pauling Institute. He was all about high dose vitamin C. We are too. Vitamin D is a good one in there.
And that's another one. It's good to get it checked too, to see if it's low to begin with. Maybe it is too.
Yeah.
And then,
ideally, we want those numbers between 50 and 80 nanograms per deciliter. The range for that, just FYI, if we kind of full circle here, 30 to 100. So if you're 31, they say, well, you're normal, you're in the reference range. We know the research says ideally between 50 and 80, your susceptibility to long-term complications or serious infections goes way down, like considerably down. So those are, we do personalized Chinese herbs and botanicals for folks as well. So it really, the name of the game is individualize the program, but there are some telltale foundational pillars like Dr. Nadal mentioned. I want you to talk about peptides too, because this is the new darling. We've spoke about them a bit, but there are some specifics for immune system health.
Absolutely.
And so how do you orient people as our peptide expert? How do we wrap our minds around it? One, what is a peptide?
Yeah.
And two, what's it doing for us?
Sure. You got it. So, I mean, if we think about maybe the easiest entry point, a lot of people, they might think peptides, they might think on the shelf of New Seasons or some health store, they think collagen peptides. Sure. Yeah, exactly. I mean, biochemically, it is related. I mean, even proteins from meat and otherwise, when it's broken down, you have amino acids and peptides. The thing is, our bodies use all sorts of peptides for cell to cell and system-wide communication in different ways. In this, for purposes of this conversation, we could focus more on the immune system. So our immune system has specific peptides that it works with. Now, these peptides aren't just free floating and kind of just pushing buttons where they need to go. These peptides are actually flanked on top of cell receptors and help improve cell-to-cell communication, sometimes in a very fast way. So it's essentially like we're changing the radio station rather than just putting it louder. We're tuning it in so there's less static. And some of the top ones that we like to work with, I think it's now called thymulin, right?
Yeah.
Start with that because it has a really nice direct hit for immune support. It helps the thymus gland to help regulate T lymphocytes throughout the lungs and cardiovascular system. Amazing during times of immune stress. Now, if we think about the root of the word thymulin, yeah, it's having an impact on the thymus gland, right? Which we know is the schoolhouse for the immune system. Once we get some new information in, it works through different parts of our body, including the thymus, and then we get to kind of reprogram and understand what is invading our bodies, right? So thymulin, great peptide to help with that. Some other ones that we have, go ahead.
One note on that. So Greg Fay published research on, he was the first one to publish age reversal research in human beings in a peer-reviewed journal. His protocol was DHEA, metformin, and growth hormone. And in particular, what he found with that was protecting the thymus gland, regrowing the thymus gland, the immune system function. As we age, it's common for that to decline, making the elderly more susceptible to infections that then take them off the planet. So in an aging component longevity play, your thymus gland is very important. That's why the thymulin is so important as a peptide when we're talking about immune system resiliency. That's my little plug there.
No, that's great. That's great. It's huge. And you're right. Like, even if, you have how many older folks or grandparents, they go to the hospital because they got pneumonia, maybe they don't die from it, but they get something else that was in the same floor, and it's just a downward spiral. Or even if they break their hip, and if their immune system was good enough, they get in, they get out, but no, guess what? Sometimes they get pneumonia. So it's true. Just keep that immune system up for as long as possible, and it is possible. Another solid one is ABP7. I think it used to be called thymosin beta 4, right? Now,
I love the names of these, yes.
I know it's, I think of physicists or immunologists, and I feel like they just tag teamed and developed all the names for these peptides because those are the ones that like to use, or astronomers, right? But
Right.
we know ABP7 is having direct support on a lot of different smaller, fast moving cell lines from stem cells, connective tissue, skin, and all that, but a huge one for immunity and recovery also. And when I
Mm,
mention recovery, I have to mention the BPC 157, which I'll call just the OG of peptides, right?
yes. Yeah.
It's been out for a long while. We like to call it the Wolverine peptide, just because it just helps everything heal just so much more quickly. I mean, from leaky gut, food sensitivities, you name it, but especially immune system cells and glands that are turning over quickly in high times of stress. It's
Mm,
fantastic.
yeah.
So I would say it's a nice triad of the three main peptides that we think about for immune support, depending on the
I
patient.
think that's great. Then I want to talk about some new and emerging tech and some tech that's been around for a while. So one, I'm going to start with the Nest Bioenergetics scan and the remedies. Also, I'm going to put a plug in. You'll see it in the notes here. You'll see the link. I'm very proud of it. We're having a bioenergetics summit releasing to the worldwide premiere November 1st through the 9th, coming right up. Get in there and get in early. There's some really cool bonuses, some great education. I learned a tremendous amount. I pinched myself on some of the people I was interviewing for that thing. There's tons of actionable information. So that's coming up. So that link is in the show notes. Click on it now before you forget and get your name and get signed up for it because it's going to release. It's going to come quick. It's 7 days of action-packed information. So the Bioenergetic Summit. Well, why am I talking about that here in a resilience program? It's one of the best devices. So we use the voice as a hologram. We can treat your whole body from your ear on auriculotherapy, right? There's Korean hand acupuncture that treats your whole body as a hologram on your hand. There's a Hara diagnosis on your abdomen in Japanese medicine. So the microcosm and the macrocosm are small portion representing the large portion. And so that is the same thing with our voice. Our voice is a hologram for the whole. So we can measure your biofields. And this is eerily accurate with Chinese medicine pulses, the meridians, connections, the different vessels that are connecting them together. And it's very potent medicine. And then there are also remedies that come with that, which is they call them infoceuticals, which are programmed information carried in water. This is the future of medicine. Now, it's been around 20 plus years, but it's still the future of medicine. So go figure. It takes a while for a thought to really catch on, but we're getting some really good data and research. And actually in the summit, I interview Hamel Patel. He's an anesthesiologist down at UCSD doing some research on these remedies. And he showed the replication of COVID and of HIV in a Petri dish to half and then diminish. Now they're doing some longer studies because they only did it for 4 days. But I think if they would do it for 5 to 8 days, we would see total resolution or no viral growth in the dish. So it's showing that this is better than placebo. This is actually real science happening on cellular regulation metabolism of viruses, which is so exciting.
It really is. It's just, there's so much information in that almost quantum level that we're just starting to really apprehend. And the fact that we could use it for medicine, it's a game changer. It's really inspiring.
It really is. It's really fun. It's exciting and it's real, right? This is when people say, one of the things that came out of this summit was all of us like to use the term woo-woo because one, it sounds fun. And it sounds very, exotic and out there, but there is more and more research. So when folks poo-poo it as too woo-woo, I'll try to get a couple more of those coming here in a sentence too. Poo-poo the woo-woo. It's showing there actually it's showing their ignorance, because there is research behind, there's research behind non-local healing, distant prayer. I mean, this stuff is powerful and potent, and there's a reason why it gets poo-pooed, because they don't want you to know about it. They don't want you to think it's effective. They think you maybe, oh, that's just a bunch of hogwash. No, it's actually way better than all of modern medicine. There are, I mean, the numbers and the percentages are very high as far as efficaciousness, meaning effectiveness. And so utilizing these things, utilizing them in your own life for your families and friends is really important. Is it the be all stand all only thing to do? No, that's why we have all of the levels in there. But why not maximize your return and your effort? And most importantly, your result. Like, we want results in the real world. So speaking of that, then we also imported, it's like Dick Tracy watch. And I am now showing my age here, but the Weber watch is laser. It's blue, red, green light on a wristwatch. And we can potentiate. So, and I actually use this for my own bout of the Delta variant of COVID, which, it was nothing to joke about. I mean, that thing laid me out for 2 weeks with a very high fever. I was really going after it with everything I knew. And I was just kind of stuck on the couch watching the trees breathe. I couldn't even watch movies, nothing. I mean, I was really sick. I brought this Weber device in, took P5P, pyridoxal 5-phosphate, is a B5 vitamin, B6 vitamin, sorry, activated B6, which potentiates. So then the virus sucks that up, and then you put it under light with the wristwatch, and that reduced, in Germany, they did some research in that in 7 days, 100% of fevers were reduced just doing that.
Yeah.
That is super immune. It is something, if you have concerns with your immune system or loved ones' immune systems, this is something to seriously consider having on board for your home formulary and your own medicine. What we saw in the last 3 years is despicable as far as how public health recommended people deal with this. Basically sending people home from the hospital saying, you're not sick enough, wait until you're sick and then come back and we'll give you treatment. Countless lives could have been saved had early treatments been developed, researched, and implemented. That would have been true public health. What we got, I don't know what we got. I think we got a compromised system and really a lifting of the veil to see how messed up our medical system is.
Yes.
And that truth hopefully will be coming out. I am putting it out late in the show because that means only our devoted listeners and viewers are hearing that. But it's also the truth. I mean, I will give you the truth as much as I can on these airwaves. And, sometimes my hackles get up. I try not to get them up too often, but this, hundreds of thousands of lives were lost needlessly. And that is a tragedy. That is on our medical professionals. Where we were gagged in talking about this and censored, credit card processing machines were turned off in certain clinics that were trying to educate the public on what to do around the virus. We're in deep, folks, and we're in it together. So I hope you liked today's show. Any last little tidbits or well wishes or inspiration, Doctor?
Well, hopefully the whole thing was inspirational. Yeah. I mean,
Yes,
well wishes
yes.
all around, but when it comes to some of these programs, it sounds like there's a lot to offer. And every step of the lab testing to the results, implementing peptides, devices, all of them, they're done strategically and on an individual basis. And there is also part of it, different coaching sessions and meeting with the providers. So there's a frequent point of contact so that everything that you're doing every step along the way. Just to bring it back to, we're in this together, and not only do you get all these things, but you get the support with it, which is equally important.
Thank you. Actually, thank you for bringing it up. So that personalizing the treatments and the coaching components to have accountability, somebody to help you implement and get into action, because we know you don't have to go it alone. So many of us are isolated, alone, kind of just out there in our own islands. And, we are here for you. This is the lifeline for Nature Cures and Be Vital. And we're coming at you worldwide. Please share this show with your friends and family. It's an important one, especially with cold and flu season coming. If you like today's show, go out and give us a 5-star. Those matter. I want to see more of those happening out there because it does matter. People look at the reviews. They want to know, what did you learn? Why this show? Please tell them, share it with us. We want to know. We want this to be interactive. We're only doing this for you. We like talking to each other, but we get to see each other a lot. We want to, ultimately move the needle for your family and the community's health. So here we are coming at you. Dr. Eckel.
Dr. Nadal. See you next time.
See you next time. Thanks, everybody.